Phase 2, the community engagement of early recognition and immediate action in stroke initiative in the COVID-19 environment. In today's agenda, we're going to talk about understanding health and stroke disparities. We'll give some background on the SEERIAS research project. We'll talk a little bit about the Pact to Act Fast, which is also making the pledge, and then our 2CEERIAS research project. ATW Health Solutions has been fully funded by the Patient-Centered Outcomes Research Institute, Eugene Washington Engagement Award to conduct the 2CEERIAS study. We're proud to have Discern Health as our subcontracting partner. Our project and research team is made up of the 3 original SEERIAS principal investigators. That includes Dr. Shyam Prabhakaran of University of Chicago, the principal investigator, Dr. Neelam Agarwal of Rush, and myself, Dr. Natasha Washington. Those who have joined our team include Desiree Collins-Bradley, Nadia Washington of ATW Health Solutions, our subcontracting partners Discern Health, Alexis Malfisi, and Teresa Smith, as well as Dr. Joe West. Despite overall improvements in public health and medicine, disparities in health and healthcare persist. Health and healthcare disparities refer to the differences in status and outcomes when we compare differences in health between groups. A disparity refers to a larger burden of illness, injury, disability, or mortality experienced by a group relative to another. Health and healthcare disparities often refer to differences that are not explained by variations in health needs, patient preferences, or treatment recommendations, and are largely linked to social, economic, and/or environmental disadvantages. Disparities in health and healthcare are not only affecting the groups facing disparities, but also limit overall gains in quality of care and health for the broader population, and also unfortunately result in unnecessary costs. According to Cigna Healthcare, disparities cost our nation approximately $309 billion. Addressing health and health disparities is increasingly important as the population of the United States becomes more diverse. It is projected that people of color will account for over 52% or half of the population by 2050. Stroke continues to rank among the leading causes of death and disability. According to the Centers for Disease Control and Prevention, its latest data representing 2018 shows that stroke remains the 5th leading cause of death in the United States. Stroke has historically had disproportionate effects on minorities and disadvantaged populations in which we see higher incidences and worse outcomes. The Black and Hispanic populations both experience higher incidences of stroke than do their white counterparts. Achieving health equity requires eliminating disparities of these health outcomes by addressing social risk factors that adversely affect excluded or marginalized groups. Within the state of Illinois, heart disease and stroke are respectively the 1st and the 3rd leading causes of death, and also the major causes of disability. In 2017, there were 25,000 deaths in Illinois due to heart disease and 6,000 due to stroke. Deaths that were due to heart disease and stroke combined were in excess of 31,000, which represents about 30% of all deaths in the state of Illinois. In Chicago alone, so if we isolate Chicago alone and we look at heart disease and stroke combined, there are over 9,000 strokes a year in Chicago. In these graphs that you see here, we're looking at the city of Chicago, and it actually depicts where majority of the strokes are not only occurring, but also where hospitalizations and deaths are occurring. So if you look at the graph off to your left, and you look towards the lower quadrants, you see the darker shaded areas. Those are the southern parts of the Chicago, or south side of Chicago, into the southern parts of Cook County. If you, and those brown shaded areas, or those dark brown shaded areas, actually represent here where hospitalizations as a result of stroke occurs. And then off to your right side in the blue, you actually see where deaths are occurring. So those darker shaded areas are where the predominance of deaths are occurring as a result of stroke. Since we know that stroke is a time-sensitive disease where early activation of healthcare system and treatment can limit brain damage and its long-lasting effects on disability. So understanding the time to get to treatment, the time to care, is very critically important as it relates to stroke and the treatment of stroke. In 2013, here in Chicago, we conducted a study where we found that white stroke victims arrived to the hospital after stroke symptoms started. That arrival time was about 85 minutes. For Black stroke victims, that same time was 152 minutes. Even for stroke victims that called 911, the time from when stroke symptoms started until the stroke victim arrived at the stroke hospital for Black stroke victims was 34 minutes longer than that of their white counterparts. Here we see a list of the certified primary stroke centers in Illinois or in the Chicagoland area. A primary stroke center, which also is referred to as a certified stroke center, is defined as a hospital-based center with the resources and processes to care for acute stroke patients. A primary stroke center is certified by the Joint Commission and recognized at the state policy levels, and in most cases, both. As you can see here on our list, the certified stroke centers are constantly evolving. As we know that Metro South in the southern part of the city, the tip of the city, actually has closed. And there was a pending potential closure of Mercy Hospital, which is number 15 on this list in February of 2021. Understanding the barriers to stroke. So again, because stroke is a time-sensitive disease, understanding why or what are some of the issues as to the reasons why we see such great differences in the times that Black stroke victims arrive to treatment than do white stroke patients. And the same is so for Hispanic. Well, in the 2013 study, there was also data collected through focus groups to better understand why individuals of the Black community and or Hispanic community were not accessing care timely. And here you can see the top reasons that were heard by patients and community members as to why they are not accessing treatment timely. Some of those reasons are financial reasons. Many individuals talked about the cost of calling 911 and knowing that there would be a City of Chicago automatic bill sent to their home for use of the ambulance. Many individuals feared being wrong. Some of the other issues that we heard is fear of being taken to the wrong hospital and even fear of the police. In some instances, we heard where family members might have had individuals on house arrest in their home. And if they were to call 911, they had a fear that the police would actually be disruptive and take those individuals away. And so because of these fears, they have all led to the untimely arrival of Black and Latino or Hispanic persons to treatment. TPA is an FDA-approved drug for the treatment of stroke. It's given intravenously, and it can reverse stroke if done carefully on select patients. And what we mean by select patients is that patients that qualify based on the number of hours that has lapsed between the stroke onset and arriving for treatment. So again, here we see the importance or the criticalness of understanding the time or our response time as it relates to the first onset of stroke symptoms to the actual time for treatment. And so what we've also learned in our study is that Blacks receive TPA half as often as whites. And this difference was completely due to delay in hospital arrival and use of 911, again, relating back to those barriers that we showed. So CEERIAS was actually, the CEERIAS engagement or the CEERIAS project was funded by PCORI in 2014. The objective was to use patient and community partnered approach to develop and implement an effective intervention aimed at increasing early hospital arrival for acute stroke in 2 high-risk neighborhoods in Chicago. This research team, or the research team, created an educational program that was inspired by and co-created with patients, community stakeholders, clinicians, and researchers. The 2 participating hospitals in the CEERIAS project were Advocate Trinity Hospital and Holy Cross Hospital. To spread the CEERIAS educational program throughout the community, the program actually trained 242 community leaders or people of influence. We also called them stroke promoters. To share the message about stroke warning signs and symptoms, dispel myths, and promote truth and importance of early arrival to the emergency room. The engagement strategy for CEERIAS was unique in that it was a deliberate democratic approach to surface the major barriers to early hospital arrival with acute stroke and to define those influential persons from the community to serve as stroke promoters. So during this time, there were more than 39,000 residents on the South Side that were engaged as a result of the work of those 242 stroke promoters. And those promoters engaged community members to complete the Pact to Act Fast. The Pact to Act Fast is also known as the Stroke Pledge, and really what it is a simple pledge, a short pledge. It says, I agree to act fast when I see someone with sudden signs of stroke. As a bystander, I will call 911 immediately, even if the stroke victim objects, because I know time loss is brain loss. And so each stroke promoter, everyone that they would share this message of Pact to Act Fast, those individuals would basically either call in, go on to the CEERIAS website, and or they would sign a pledge card, and we were able to track the number of individuals or the number of persons online, paper, or telephone. The Pact to Act Fast is basically a standardized pledge that's executed, by the community members, basically attesting that they would call 911 in the event of stroke. Here's just a number of different types of engagements. I mean, everything from going out, walk with the doc, to going out to beauty and barber salons, to doing tours at local hospitals, to going to actually nightclubs and social events to spread the message about stroke. There were 2 significant findings from our study as a result of the work. One was that there was an increase in younger people, men, and Black patients in the community who arrived at the ER early for treatments. That's critically important, because what we're saying is that after the message of stroke was spread by the stroke promoters, essentially when we went to go and look at whether or not arrival had improved at our 2 hospitals, Trinity and Holy Cross, they did for younger people, men, and Black patients. Secondly, people who used an ambulance when they thought they were having a stroke also improved after the program began. Remember, early arrival means treatment or more effective treatment. So what's happened since all of the community engagement work? Because again, remember, we were out everywhere, going to churches, at businesses, going to local meetings, you name it. Our stroke promoters were literally everywhere spreading the message about the signs and symptoms of stroke. But COVID-19 certainly has impacted public life and healthcare delivery and the utilization of just the healthcare system. We've had rapidly evolving federal, state, and local policies, all in response to the COVID-19 pandemic. Really what you see here is that COVID-19 has also rendered many of the same disparities that we see among stroke. As a matter of fact, these numbers suggest that COVID-19 is now the third largest cause of death in the United States, and stroke has moved to number 4, and this is based on data as of June 2020. So what do we know about stroke and regionality in Illinois and Chicago? The same is the case. So you remember when we talked a little bit about earlier where strokes were occurring, where we were seeing more hospitalizations and where we were seeing more deaths occur. Here we see the same dark shaded areas in the southern part of Chicago, which is that upper right tip of that upper right quadrant. So if you look at whether it's COVID-19 cases in Illinois or COVID-19 deaths in Illinois, certainly COVID-19 has exposed the disparities in outcomes among Black and Latino populations. And so 2CEERIAS really was birthed from that fact. The fact that we were able to improve outcomes based on community engagement efforts during the CEERIAS project. Now that COVID has come, we want to really look at how can we use the virtual environment or virtual platform to really share the message about the signs and symptoms of stroke, and to see if we would reap similar value in the testing of that. So this project actually has 3 specific aims. 1, to produce recommendations for future patient, family, and community-driven research priorities, focus on stroke education and early treatment for Black and Latino communities. We're also going to address the barriers to community stroke activation and assess the impact of neighborhood-level factors on stroke-related disability in the COVID-19 environment. And then we're going to disseminate a modified educational intervention. So that PACTEC FAST, we're going to modify that based on what we hear from our promoters. We're going to share that online through virtual mediums, and then we're going to get some feedback so that we can influence PCOR moving forward. So our goals are to increase knowledge, basically to understand how COVID-19 has impacted the work of early warning system, meaning sharing that community-based messaging. Also, we're going to look at social media as a platform for engaging communities of Black and Latino and or Hispanic communities. And then we're going to work to enhance that messaging among Black and Latino communities about the signs and symptoms of stroke, in particular as it relates to COVID and the COVID environment. So as you prepare for your convening or for the virtual convening as a stroke promoter, we ask that you follow us on any of or all of these social media platforms, from Facebook to YouTube, the ATW Health Solutions YouTube page, as well as the 2CEERIAS website. Please make certain that you mark that. Thank you so much, and we look forward to you participating as a 2CEERIAS stroke promoter.